focusing on what does it mean to try to provide enrollment assistance in a world where a global pandemic is going on and many of us are working from home and social distancing practices are in place. So that's really changed the nature of everyone's work, but especially those trying to serve vulnerable populations. So we're going to start with that, but I'll pass it to Aurora. A couple of quick housekeeping things. Please feel free to make use of the chat and the Q&A sections. Those are buttons on the bottom. It's helpful if you put the Q&A, if you put actual question on the content in the Q&A, just so we can track it a little better. But this is a small group. We'll be able to track through chat or Q&A. Both can work. So feel free to use those. It's really helpful for us as presenters to have a little bit of engagement. And then at the end, if we've got time, I can actually unmute participants if you would rather. If you have a complicated question that's kind of hard to type out, we can do it that way as well. So we'll give some time at the end for out loud questions if you have one, but feel free to ask questions via chat and Q&A throughout the presentation. So we've got a couple more people who signed in, so that's great. So I think we're ready to get started, and I will turn it over to Aurora.
Yay, thank you, Melissa, for that wonderful introduction. My name is Aurora Harris, and today I'm going to be talking to you all about some remote enrollment strategies for the Affordable Care Act specifically. So we're going to specifically be talking about healthcare.gov, the ACA, Obamacare, all that fun stuff. And Melissa, at her presentation later on, will be talking about the Your Texas Benefits piece and how do we do that remotely. But I'm going to be specifically talking about the Affordable Care Act or healthcare.gov. In building out this presentation, I actually drew from two of our really, really strong partners, one in Houston, Change Happens. They are a navigator and they have been doing remote enrollment assistance for a number of years. So I had extensive conversations with them in building out this presentation. And then I also talked to foundation communities out in Central Texas or in Austin. They've also been doing remote enrollment assistance for a number of years. And so the things that you're going to be hearing from me today are best practices that I drew from some really incredible partners on the ground. And I'm going to be linking their resources and their contact information in my speaker notes as well as a slide. And you'll get a copy of my slides. And so if you have like deeper questions that I might not be able to answer today, I have prepped them both and they're both ready and willing and waiting to hear any questions that you all might have. But I wanted to let you all know that that's kind of where I got this presentation from and a lot of these best practices from. So just a couple more Zoom norms. Melissa already went over these, but we are a small group today. Looks like it's 10 of us. So use the chat box and use the Q&A function. You know, we're all on Zoom calls all the time. And so I know it's going to be tough having someone like talking at you, but try to remove distractions, grab a beverage, you know, get those note-taking materials. And then last but not least, you know, tech happens. So if you get lost in the call, if you're having any issues, just chat us away and we'll make sure you get back in on the Zoom call. But we're all used to Zoom by now, so we should be good to go. So a little bit about me and Young Invincibles. I've been with Young Invincibles for 4 years, I think. We are a nonprofit organization dedicated to the economic security of young people. So we represent millennials, Gen Z, really, really fun group to represent. But we talk a lot about healthcare access issues because we see it as a huge building block for economic opportunity. And we've been around for about 10 years now. So today we are going to talk about healthcare access in Texas. We are going to talk about remote enrollment assistance and some big bullets is prepping for the appointment, privacy, some promising practices from the ground, and some promising practices around client follow-up. And then we're also going to talk a little bit about working through Medicaid gap clients and kind of what that's like. And fair warning, I build my decks a lot of times over the weekend, and I watch a lot of Real Housewives and reality TV. So you're probably going to see a lot of gifs of reality TV shows. So just a fair warning. All right. So we're going to talk a little bit about what's new for plan year 2021. So a lot of you who've been doing this work know that when you enroll someone in a plan, it's for 2021. So we're going to talk a little bit about what's new, what's not so new, what's the landscape kind of looking like. So we've got our standard, well, now standard, it used to be much longer, open enrollment timeline for 2021 plans. It's shortened, and it is during an election year, a really big election year. So might be a little bit tougher for us to sort of push the narrative about open enrollment out there, but we at Young Invincibles will have some really good media strategy and things like that at our conferences later this week, as well as at our conference with Every Texan and TAC, and I'll talk a little bit about that at the end of the presentation. But open enrollment starts November 1st. It's going to end on December 15th. And folks who enroll in that sort of standard period, their plan will begin on January 1st, 2021. So we're dealing with the sort of shortened standard open enrollment timeline for 2021. As we all know, many folks in our communities are losing their job-based health coverage. So 1.6 million Texans are projected to lose their job-based coverage. Just, you know, we all work in these communities. We know how tough and vulnerable our communities have become and really have always been. We've always had the highest uninsured rate in Texas. So the pandemic has just really exacerbated an existing issue, right? And I know I'm preaching to the choir here, but millions of people are projected to lose their health insurance across our state, which means that we have an enormous opportunity to educate and enroll many people in the existing resources that they might not have known about or might have thought that they weren't eligible for. Or maybe they weren't eligible for in the past and might be eligible for now. In terms of federal legislation, you know, we got the CARES Act, and, you know, one of the biggest relief packages Congress has ever passed. Now the House, which is democratically controlled, wrote up the HEROES Act, which Young Invincibles on our advocacy side was in support of. There were some things in there we still wanted to see, but overall we were supportive of it. And then there's the HEALS Act in the Senate. And right now, I know if you all have been paying attention to the news, conversations and compromise between both of those acts have stalled, mostly around the unemployment benefits piece. You know, a lot of folks in our communities are really relying on that. And so conversations around that between our legislators have stalled. And so we have not seen another round of stimulus payments. We haven't really seen what's going to happen with the unemployment benefits piece, nor do we know what's going to happen around COVID treatment without cost sharing. So definitely waiting on our federal legislators to come together, come to a compromise, and pass something that provides more relief to our community. So we'll kind of see where that goes. There was some hope that that would pass before the election, but a lot of folks are saying it probably won't. But at the end of the year, something might pass because they have to pass a large funding bill legislation. So hopefully some COVID relief will happen, you know, after the election, but we're gonna keep our eyes open for you all and kind of keep you updated there. And then in terms of the outreach and enrollment landscape, this is looking similar to last year. So federal funding cuts to outreach and enrollment support remain. So that means that now we only have, we continue to have only 2 navigators in the state of Texas currently, one being Change Happens here in Houston. Despite being in this pandemic and despite the ACA and healthcare.gov being can be considered a big resource, right, for Texans and Houstonians, outreach and advertising for healthcare.gov is still reduced and, you know, won't be, you know, fully funded or funded as it could be funded right now. So we're really looking at a landscape that requires us as advocates and as sisters to really do the bulk of the work when it comes to outreach and enrollment and advertising that the ACA is a resource. So we're kind of still within that landscape. So how are folks accessing healthcare right now? If they've lost their jobs, they qualify for the traditional special enrollment period. They can go on healthcare.gov, so provide some kind of proof that they've lost their job-based coverage and enroll in a plan. If they've had to move due to COVID, that's another one that they could use. If they're a young person and they're blessed that their parents still have their insurance, they can stay on their parents' plan. Broadly speaking, you can get Medicaid or CHIP for children. And then, of course, we have those non-health insurance options like a federally qualified health center or a women's health program, or our local health programs like our Harris Health System that they can access, but we know that that's not actual health insurance. So that's sort of how folks are using our patchy healthcare safety net in Houston and Texas right now to sort of find coverage. I think another good piece of good news that kind of came out of the administration is that folks can use the FEMA special enrollment period. So usually this is for natural disasters like hurricanes and things like that, but they have extended it for COVID. So anyone who qualified for a coverage loss special enrollment period after January 21st, but they didn't enroll due to a COVID disruption, they can still enroll through the FEMA SEP. So the details of this are that if you're in a state that declared a state of emergency, which is every state, and if you lost coverage at some point during that state of emergency, you can qualify for this. You will need to still prove the loss of coverage, but you don't have to prove that you missed the 60-day window due to COVID impact. Their lives have been disrupted somehow for COVID, so you don't have to prove that piece. So this is something, again, we wanted to kind of lift up to folks to say, hey, consumers can qualify for the FEMA SEP as well. So we're in a place of a lot of uncertainty, and our federal leaders right now are not coming to a compromise, installing aid, and not providing funding we need to give outreach and advertising to healthcare.gov. That's the bad news. The good news is that consumers more than ever are looking for assistance. And when they received help enrolling, they think they wouldn't have completed enrollment without the help. And this comes from a Kaiser Family Foundation report on consumer assistance. 12%, or about 5 million people, sought help but couldn't find it. 1 in 4 consumers who enrolled with a broker, and those are people who work for like private companies, were offered a non-ACA compliant plan. So when they go with a broker, they're often offered like a short-term plan, right? And overall awareness of the status of the Affordable Care Act, the enrollment deadlines, all of the different comprehensive coverage remains low. And so this might not sound like good news, but it is good news because we have the opportunity on this call to help really educate and engage folks and really provide them with support. Another thing that from this report that I really wanted to share that I thought was really interesting was that there was really no big difference in the type of consumers who sought help with a health plan at all. So like you would think it would be communities that traditionally haven't had access, but no, there wasn't a huge difference in race and ethnicity, wasn't a huge difference in age. So lots of different people are seeking help around assistance for the ACA right now, which I think was also something that was really interesting. I don't have to tell you all this, but reasons that people are seeking help applying for coverage is that they don't understand their health coverage options, and that they feel the process was too complicated to complete on their own. So again, this provides an opportunity for us on this call to really engage with folks in new ways and help them understand all the different resources that they do have available to them. And last but certainly not least, when they do speak with the type of people that are on this call right now, they rate that assistance really highly, and they say that they would not have gotten the same coverage without the help that you all provide. So again, the work that you do is critical, and it's always been critical, and COVID has just shined a light on the incredible work that you all do. So with that being said, I am curious, if folks on the call already conduct remote enrollment assistance. So if you could put in the chat box if your organization is currently conducting remote enrollment assistance, or you're looking to, or you've dibbled and dabbled in it, sort of where are you? I'm really curious, folks on the call. So if you could take a moment to let me know if your organization conducts remote enrollment assistance, that would be great. And I'm gonna plug up my laptop while we do that.
You folks can use the chat function.
Okay. Cool. So Crystal says no, but it's something we'd like to do in the future. Nice. So this will be perfect for you. Stacy says yes, we are conducting remote assistance. Oh, great. So Stacy, you are probably.
She's a Change Happens. I don't know if you know Stacy.
Oh, I know Stacy.
Oh yeah, I thought so. I was like, where are you to Stacy? She's there. She's Change Happens rock star.
Yeah, I mentioned Change Happens right at the top of the call. Esther says no, but want to learn more about it. Great. Awesome. So Stacy, we might have to unmute you at the end if there's questions I can't answer. I might have to like go to you. It's exciting. Yeah, so thank y'all so much. So this really helps me figure out who needs to know what. It's perfect. All right, so let's get into it a little bit. Okay, remote enrollment assistance. So there's 3 types of consumer assistance, and we are certified by CMS to provide marketplace enrollment assistance virtually. So if you can do a remote assistance, the answer is a resounding yes. So navigators who are grant funded by CMS, they can do it remotely. Certified application counselors, which we talked about at my last training, can do it remotely, as well as brokers. And they actually don't even have to be in the state, which is a little scary, but you can do this types of assistance remotely. All of you can. So the first thing, and one critical thing that you want to do is obtain a consumer's authorization. And you want to get their consent that you can talk about their personal information, their healthcare information, anything that's personally identifiable to them through the conversation and through enrolling them. So there's 2 kind of components to that. The first is their actual authorization. So you want an acknowledgement that you actually inform them of the general functions of your role and what you do. And then you want to get consent for you to access and use their PII. And then you also want an acknowledgement from them that they can revoke that authorization at any time. So that's sort of the first piece. Those are the 3 main pieces you want in the authorization. And then the second piece that you want is a record of the authorization. So you can actually read them, your organization's like standard written form over the phone. And a good practice is to make sure that there's a record of the authorization and that you can email that to them if they request a copy, and make sure that's available as soon as possible. When I talked to Change Happens in developing this presentation, actually, they said that CMS has developed a model consumer authorization form that they use, and that's a really great practice, and they like to read that entirely. But you can also develop one for your own organization, as long as it has these key components kind of listed here. And again, consent can be given over the phone, in writing, or both. So you can get that consent over the phone, and you can kind of sign virtually for that person. And you can also sort of get it in writing from them through email. And we can talk about DocuSign, and we'll talk about some of that stuff a little later in the presentation. But you definitely want to get the consumer's authorization. I mean, you can do that virtually before you start enrolling them or talking to them about anything like that, especially if you're going to be talking about their PII in any way. For your physical space, we're all working at home. So you definitely want to set up a private area at home to work securely. So one thing I like to think about is privacy is also, the HIPAA piece and the consumer authorization piece, but it's also privacy in a sense of, does the consumer or your client feel like you are taking their enrollment and their personal information seriously, right? So if they can see you, for instance, if you're doing this over Zoom or something like that, you want to make sure that you look like you're in a private area. You're in a private area at home to work securely, right? You don't want to make that person feel like their information is just sort of out there. So there's like the perceived security, and then there's the actual security, right? You want to use a work computer if possible. I don't know, I might be talking to some folks who may be CACs, but you want to use a work computer if possible, or a computer that is not shared with anyone else and that is like password protected in some kind of way. You definitely want to limit the amount of paper with personal information. And when I talk to folks on the ground, they like to limit the amount of paper, as much paper as possible. And any sign-in sheets from virtual appointments usually do not have PII on it. It might be something just like names and phone numbers, email addresses, things like that. And you also want to digitize those as much as you can. You want to check with your organization's IT department. Maybe they have some compliance or some things that they can do to help make systems more secure for your remote work. So you want to just check and be sure of that. And then lastly, you want to use those headphones so that no one else can hear the consumer. I know we're not always privileged to be able to work from home in a private, quiet space. You might have kids and things like that at home, but you want to be in a private area, and then you want to definitely use headphones so that no one else can hear, like the consumer. So let's talk a little bit more about their online privacy. And I did say I was watching a lot of Real Housewives, so just bear with me. You want to use a private Wi-Fi with a password or hardwired internet. Again, make sure your computer requires a password for login, and get VPN access from your IT department if needed. And then when it comes to uploading documents for the healthcare.gov website, in talking to navigators and assisters, they said that they like to walk the client through this as much as possible, and have the client do that themselves if they can. Again, because you don't want a lot of PII or anything like that on your own computer. So if you can walk the client through that, that is considered a best practice. And you want to clear out your computers at the end of the day, because eligibility forms from healthcare.gov and those types of things are considered the personal information. So you want to make sure that that gets cleared out every day. So some tips for communicating with clients. You want to set up a secure email account, and this can be done to your existing email accounts like Outlook. You want to password protect documents when you are sending a client secure information, and you want to share the password in a separate email, right, with the document. So you don't want to share those things together. So you want to share the password first, and then you want to, in a separate email, you share whatever protected documents you wanted to share. Remember to adhere to your HIPAA requirements when exchanging any personal health information. Also, if you are maybe a CAC or you don't have a work phone, there are some things you can do to protect your personal phone number, such as things like using a Google Voice number, calling private, some of those things to help protect your own personal phone number. And then if you're not speaking directly with a client, make sure you're speaking with someone who's authorized to speak on the client's behalf. I think that that's really important. And this came up in our last webinar, but using a language line interpreter for assisting clients in other languages is really great. And you could also use the Marketplace hotline for this piece as well, for different languages as well. This is another, I think, a critical piece of information, and this might sound basic, but I think that it's important to know. So the Office of Civil Rights, they are responsible for enacting like certain regulations under HIPAA. They put out some discretion for healthcare providers in different like video communication products that you should be able to use as providers. And I thought, well, if it's good advice for providers, it might be good advice for CACs and assisters and navigators on the ground. So basically, when you're doing any kind of telehealth service, they advise us not to use anything public facing, right? So you don't want to be doing someone's like ACA plan on Facebook Live or TikTok or anything like that, anything that's public facing. And they also had a really great list of some vendors that they can provide HIPAA compliant video communication products. So I wanted to sort of lift those here. Some of them I think a lot of navigators and assisters already use. So like Skype for Business, I see a lot of Microsoft Teams. I know Change Happens, I believe you all mentioned using Skype before. There's Zoom for healthcare. There's GoToMeeting. That's something we use at YI pretty frequently. Cisco, WebEx, and then the rest kind of goes on. But these are, I thought that was a really cool list of some vendors that might represent some vendors that are HIPAA compliant video communication products for you all if you're interested in using those. But I also know that a lot of these have video, and a lot of clients, that might be a huge barrier for them, and that by phone is considered more of a best practice. But if you do have clients who can use video, this is a really great list that came out of the OCR. I think I see something in the chat. One second. Oh, Microsoft Teams, yes. And I think, Stacy, that was mentioned on here. Yep, Microsoft Teams. So when it comes to obtaining and signing documents, this is a bit, that's a little tricky, especially for clients who might not have access to a computer or like a laptop, but these are some free apps to help obtain electronic signatures. So there's DocuSign, there's Adobe Fill-In Sign, and there's Sign Now. So if you need document sign, these are some suggestions of some free ones that can help with that. There's also eFax, Fax App, and Fax Pro that are free online fax programs so that people can fax you things digitally. And again, applicants can use secure emails also to send in images that are scanned or photos of documents if you need that. They can also eFax you documents with some of the things that I listed earlier. And like I mentioned before, what's considered a good practice is having them upload those documents directly to their healthcare.gov account if they're able to, like walking them through that via phone. So I know I said a lot in all of that. Are there any questions on any of the things that I've been mentioning or talking about? Or is this a surprise to anyone? Or is there anything that folks want to add before we go to some more promising practices? Okay, cool beans. So let's talk about some promising practices. And again, I got these from our friends at Change Happens here in Houston, a great navigator that's been doing a remote enrollment for a number of years. And then I also talked to Foundation Communities in Austin, Texas. They've also been doing remote enrollment for many years. And so these are some promising practices that came out of some conversations that I've had with them. So the first thing is people often say, well, you know, why not just call the marketplace number? You know, why not just do that? And the biggest thing is that you offer local personalized assistance. You are a part of their community and you can provide resources to them if they don't qualify for ACA plans. You can provide resources for them that are beyond just the ACA, local food banks, for example, other programs for children. You really know the community and you really know these insurance plans and you really know these providers and these networks. So you're a huge valuable resource. That's the first piece. The second piece is that a big promising practice is to let your clients know that you are doing coronavirus or virtual enrollment appointments via phone. So these are just two flyers from the folks that I talked to on the ground. One is from Change Happens. They did a drive-through backpack giveaway and they put in the backpacks the services that they actually provide, right? And I think it's a really good example of saying we're a community that offers you this personalized assistance, but also offers you other resources for your family, right? And I think that was just a good merge of that. And then this is a great flyer from Foundation Communities that talks about how you can schedule an appointment via phone to walk through the healthcare.gov website. And I think these are just really good models that folks are free to use and copy to let communities know they're offering this personalized assistance via phone or Zoom or Microsoft Teams, whatever you might use. Yes, Crystal, you will definitely get a recording and you will also get a copy of all my slides. All right, so some good promising practices before the appointment is that you really want to set expectations because a client might or a consumer might think that just because they talk to you that they're going to qualify for a plan or that once they get off the phone with you, they got health insurance, right? So you really want to set the expectation on what it is that you do and what it is that you all are going to be talking about. So you really want to agree on that appointment purpose. Again, you want to get that consent that we talked about earlier. And you want to talk through the logistics of remote assistance. Will this be via phone? Do you want to do this and see my face on Microsoft Teams, for example? What's that going to look like? But generally speaking, from what I have heard, again, for these conversations, is that by phone is really a best practice. Walking folks through the application and you're on the phone with them and you are asking them the questions that are on the healthcare.gov application out loud is considered the best practice and reduces the amount of barriers for your client. And then you want to have a checklist for clients, like what are the things that they might need at this by phone appointment. Make sure you know what your projected income is, how many kids are in the tax household, those types of questions. Maybe have a checklist for them is considered a good practice. You also want to do a little screening for eligibility, because like I said, some folks might think that just because they have a conversation with you, they're definitely going to qualify for an insurance plan, and we know that that's not always the case. So you want to do a little bit of screening. You want to kind of get at what's their household information, what's kind of going on there. You want to see if they qualify for a special enrollment period, and I'll talk a little bit about that in the next slide. You want to see, have they already applied for the marketplace before? Do they remember the login information? Do they need to do the password recovery? That's a really big one. And because it's over the phone, 90 minutes may be better than your typical hour appointment, just because you have to, walk someone through it over the phone. They're not being able to sit there with you. It just might take longer. Or on the call, you might want to say, hey, we only have an hour right now, just because of maybe that's the nature of the work, but I can definitely schedule that follow-up hour with you, and we could do this in separate appointments. But letting the client know you're going to give them as much time as they need to get them enrolled. But generally speaking, it might take longer than an hour just because it's on the phone. Some other good client resources before you set the appointment is that some folks might not know if they already qualify for coverage at work. And so Foundation Communities had a really good example of an employee eligibility form. So basically, you give this to your client, ask them to give it to Human Resources to say, does my employee have access to a health insurance plan via work? Just so that they can kind of have that before they come to your appointment. And then another big one, I think, and this came out of some conversations here in Houston with some Houston partners, is forgetting their password if they've already logged into the marketplace before. So this is a really good resource on, if you've lost your login, and I'm smiling because this would happen to me a lot when I was a CAC. Here's how you can find it. Call the marketplace, ask the rep, talk to them, and get that temporary password so you can get back into their account. And then another piece of this that I thought was a really good promising practice was the consent form. Foundation Communities has a consent form where you can actually mark that you are authorized to sign for the consumer. So when you're getting that consent over the phone, you can mark that, sign it, and date it, and kind of send it back to them. And then also, again, like I mentioned before, Change Happens as a Navigator mentioned that the CMS consent form was a really good promising practice and something that they use. And so that's also linked here. And in my slides, in the speaker notes, you'll see copies of both of these consent forms that you are free to use in order to get consent from your clients. Another great promising practice is screening for a special enrollment period. We know that so many people are experiencing job loss, are moving. Did you get married? Did you have a baby? Did you turn 26? Did you gain a dependent, right? There are lots of different special enrollment periods. So just because it's not November 1st, doesn't mean a person doesn't mean a person can't get a healthcare.gov plan. So before you have that appointment with them, sort of ask and screen for some special enrollment period questions to see if you can go ahead and enroll them right now. Again, generally speaking, by phone was considered to be a best practice, which means that you're going to have to do plan selection by phone. And I think a big piece of advice here is that, you are the expert on the marketplace and they are the expert on their lives, right? And so getting a real understanding of their clients' needs and building that trust, I think, is a general best practice. Trying to find out, are you looking for a health insurance plan just to be covered and just to have access to general care? Or do you have some specific medications or specific things that you're really needing or looking for? I'm trying to get at some of those questions will really help you. I also think, and especially working with young people, that a lot of people don't know about the comprehensive coverage of the ACA plans, understanding that things like your well woman are covered, things like birth control access are covered. Those 13 essential benefits, ambulance care, all of those things, a lot of folks are not aware of. So I would definitely emphasize that, because a lot of people will come to it and say, oh, I know it doesn't cover cancer. I know it doesn't cover this or that, and actually not knowing how many things are actually covered and how comprehensive these plans have to be because of the ACA. So that's something I would definitely emphasize. Another best practice that I've heard from the field is you want to avoid insurance jargon as much as possible. People want something that they can afford, that they can use, and that they can understand. And you want to explain the insurance using the insurance plan. So, saying something like, all right, with this plan, your premium would be $25. You have to pay that every month, similar to a gym membership. You have to pay it just to keep it. Okay, and this is the deductible. But using the plans that are in front of you to explain insurance is considered a best practice, rather than trying to use insurance jargon and explain it before they get to the plan selection screen, if that makes sense. Is considered a best practice. And then again, just comparing plans through cash flow and network. So this is how much this is going to cost, using percentages and things like that, and what's in network, what's not in network. These are the different plans that you have, et cetera, because the person's not going to be able to, if it's by phone, they're not going to see the same screen that you're seeing. And so it's just really good to use like layman's terms and really kind of talk through these things as much as you can without using so much insurance jargon that they can't really understand what they're getting and how to use it. And I don't think I needed to say all that to you all. You all do this work, but just kind of emphasize that. So after the appointment's done, I thought these were some really cool resources from some partners that I spoke to around what do you do after the appointment's done. So let's say you did a remote plan selection, but the person really wants to see what you picked and what you were talking about or looking at. Foundation Communities has a great remote plan selection document that I linked in my speaker notes here that kind of talks through how do you get into your own account so you can see what those plans were. A good post-appointment follow-up next step is to also do like an email summary of the appointment and what the next steps were. So this is what we talked about. This is what you said you were going to do, right? It might be remember to make that first premium payment. I know a lot of folks that I worked with in the past were like, oh, I thought I had health insurance and didn't know they had to like pay, that first payment. So that's something that's really big. And also that's something that's really big for us at Young Invincibles is health insurance literacy resources. So if you have a one pager or a YouTube video or something that explains premiums, deductibles, co-insurance, that you could also link in that follow-up email, that is considered like a really great best practice. Another good best practice is an insurance company one pager. So again, you all provide that localized assistance. So if there's a local plan that you can provide a quick one pager on of like, these are the numbers that you can call before you sort of get your packet or you get your online notification, I think that's also a really great resource. And then how to upload documents to the marketplace. Again, when I spoke to the folks at Change Happens, they talked a lot about having the client upload those documents to the marketplace themselves. And so I think that this is a really good space where you can do that in that post-appointment follow-up of tagging this one pager and saying, this is how you upload documents to the marketplace so that we can have a smoother appointment. Okay, so I feel like I talk so fast, I don't mean to. Are there any questions on the post-appointment follow-up piece, plan selection, consent forms, any of these sort of things that I talked through that are some promising practices from the ground at all, or any other practices that you all want to lift up in the chat? Again, use that chat box, feel free. You all are incredible experts, so anything you all want to lift up as well, I'd love to hear it. And I will add it to the slide before I get it out to you too. So let's talk about Medicaid, because this is something we have to talk about in Texas, right? So of the 1.6 million Texans who are projected to lose their health insurance, 30,000 of them would have been eligible for Medicaid if our state had actually expanded the program. And so what that means is it's very likely that you might find someone who is in the Medicaid gap, someone who doesn't qualify for an ACA tax subsidy, and they also won't qualify for Medicaid. So wanted to talk through some steps that I heard from folks on the ground about what to do in that situation. So you want to have information for the Harris Health Gold Card plan immediately. That is something that lots of low-income folks in Harris County can access. And you want to be able to direct them to a real name, like a real person, right? Because they came to you because they wanted that local personalized assistance. So you want to be able to say, you know what, Melissa at Acres Home Multi-Service Center is expecting a call from you. This is her number. You know, she does eligibility for this, right? Because you want to continue to give them that personal touch. So it's really important to direct them to a real name, a real person. And so have those linkages already there so that you can help navigate those folks to like a Harris Health Gold Card situation. You also could do the same thing for a federally qualified health center. So, you know, Elizabeth down at Legacy Community Health Services, she got you. She's waiting on you to call her, right? This is her number and eligibility, call her, right? You also could do patient prescription programs. A lot of people want to get an ACA plan with helps with prescriptions. So having resources on Costco, Sam, GoodRx plans to help with those prescription costs is really great. And another good thing personally, and you know, advocacy wise, that would be wonderful, is if you could connect those consumers to coverage gap campaigns. You know, they might feel reasonable anger and want to advocate to close the gap. And so if you want to connect them to a coverage gap campaign, you can create a separate consent form for that and include an area where you're saying you can authorize a collection of their PAI to be connected to a coverage gap campaign. You could connect them to Every Texan, to Young Invincibles, to a great campaign called Sick of It Texas. And you can help like provide information about those campaigns so that they can help us in closing the coverage gap and all that kind of fun stuff. So if you want to be able to like do that work, I think it's incredible work, and you all are powerful advocacy tools in connecting consumers to campaigns. This is a really great way to be able to do that. And again, in the standard consent form, you could see if you can authorize a collection of their information to be connected to a campaign and say, hey, in case you do fall in the gap, can we connect you to a campaign? And you can definitely do that. And I have a resource again in my speaker notes on this slide about what that consent form could look like. And then another piece of this is that they might not be eligible for a tax credit through the ACA marketplace, but their children might be Medicaid or CHIP eligible. In that case, those systems tend to talk to each other, but you want to let them know that if they don't hear from anyone on the Medicaid and CHIP side in 10 days to call you back. And then you also want to make sure that you're following up with them and that they did the things that they needed to do to help get their kids in Medicaid and CHIP. So you want to make a note to do a follow-up with them. So again, those systems are supposed to talk to each other, but just want to do that like 10-day follow-up to say, hey, did you hear from anyone? Did you go on your Texas benefits or anything like that? And, you know, make that note to do a follow-up with them again, to just like keep them in the loop and make sure that they're getting their kids enrolled there as well. In addition to the coverage gap piece, if folks are interested and want to share their story, we do have a story hub at Young Invincibles right online where they could enter in their healthcare story and sort of help us in our fight to expand Medicaid at the state level, especially during this pandemic. We need Medicaid expansion more than ever. So I wanted to do a shameless plug of our story hub, because you can also direct your clients here if they're interested in sharing their story. So our ask, you know, basically is that you go to our Get Coverage Story Hub and, you know, quickly share a story on why coverage matters on any device. They can do it on their phone, computer, or their tablet. So any questions about the Medicaid gap and some best practices around navigating that and navigating children and CHIP into Medicaid at all? And Melissa will cover this probably a little bit more in depth in a couple of days. Alrighty, cool beans. Um, so I want to also talk about our connector tool and virtual appointments. So um, most folks might be familiar with the connector, but just in case you're not, it's designed to connect consumers with application assistance in their community. Last year, we added a reporting and new calendar sync feature, which was really exciting. And we've been thinking about how do we adapt the connector to these new realities of social distancing that we're living in right now. So essentially how the connector works is a person will enter in their zip code. So like mine is 77004, shout out to Third Ward. And then they would click search for help, right? And then that would connect me more than likely to Change Happens. They are the closest like navigator in my community. And then I would be able to schedule an appointment with Change Happens and like, talk through the healthcare.gov website and talk through my insurance plan. But given everything that's going on, and given that everyone's probably doing online appointments given COVID, we've made it to where you can mark your location services everywhere without doing a lot of upfront work. So if I go in there now and I put something in, I can just click schedule online, and it won't necessarily connect me to the closest to me, but it'll connect me to anyone who's doing virtual appointments, if that makes sense. So with that feature, we just wanted to let you all know about that. If you're not already on the connector tool and you want to be, please give me an email. We would love to have you on the connector tool. Just to give you a sense of how impactful this tool is, I would say we probably connect about 5,000 to 6,000 Texans a year to individualized service every year. And so we would just love to have as many partners on the connector tool as possible, especially since so many of us are doing it online. We would just love to have that on there as a resource so that folks can type in their information and get connected to you. So please let me know if you're not already on it. We'd love to have you. And then last but certainly not least, wanted to talk through some outreach and enrollment planning tools that we have coming up. We know that this is a scary and unprecedented time, and we want to be able to facilitate conversations with people who are doing this work across the state and across the country on what are they planning on doing, how are they planning on doing it, how are they getting the word out about the ACA and healthcare.gov in the middle of one of the craziest elections I think I've ever seen. Granted, I'm only 31, but how are we kind of doing that? So we at Young Invincibles are having an outreach and enrollment planning summit. It is this Thursday. It's from 10:30 to 4:30 Eastern time. Of course, you don't have to go to the whole thing, but it's virtual, it's free. It's for navigators, CACs, assisters, anyone who's interested in Affordable Care Act outreach and enrollment, anyone who just like wants to like learn about it and talk about it is welcome to come. We're going to be talking about the landscape. We're going to be talking about best practices for outreach and interactive planning. So it'll be really fun. Yeah, so please come to that. And then we also have a Texas version, right? Because, everything's bigger and better in Texas. So we have a Texas version that's hosted by TAC, Every Texan, and YI. Again, that's also virtual and free. Anyone is welcome. And we're also going to have sessions on like healthy Texas women, SNAP, self-care. We're also going to be talking about diversity, equity, and inclusion in the work. So I'm really, really excited about that. And that is a series of sessions that are from 10:30 a.m. to 12 and 1:30 to 3. So please come. Melissa will probably follow up with how to register for that conference in a follow-up email where you'll get a copy of the slides and my virtual recording. But I definitely wanted to do a lot of plugging of those because we'll be talking about all these issues even deeper as we approach open enrollment. So again, you'll get these slides. And you'll get the recording of this. And then I also really wanted to shout out Foundation Communities and Change Happens. They gave me a lot of great tips on how to do this remotely. And so I have definitely linked all their resources here and in my speaker notes as well. Alrighty. Any questions on remote enrollment assistance and anything that I kind of talked about throughout the session? Any questions?
And if you would prefer to say your question out loud, you can raise your hand and I will unmute you. Or if you just want to say hi, I'm happy to unmute folks as well. Oh, Stacy,
Hello?
you are unmuted.
Hello, ladies. Oh my God. You guys have done really, really well. That's probably why you don't have that many questions. It was a lot of information, but it was covered wonderfully, if I should say so myself.
Oh, thank you.
Yeah, you guys had a lot of information, but it was really covered wonderfully. Like I wrote really good notes off of things I think I knew but didn't know, just to confirm some things. So I want to commend you both from YI as well as every Texan. You guys have done a great job with this presentation. And just a shout out to the connector tool, just to tell everyone during open enrollment and SEP time, it is a great resource and a tool to use to keep things in order. Again, thank you guys for just doing this, putting this on. Thank you very much.
Oh, thank you. I couldn't have done it without talking to you for like 2 hours, Stacey. So
you guys did a wonderful job. Like this was awesome, Aurora. This was really, really awesome.
Oh my God, you know what? That's great. I'm gonna start saying questions and compliments if you want to do that. That was really great. Thank you so much.
I love it. I love it. Well, and thank you, Stacy. Anyone else have a question or any feedback before we end for the day? The other thing I just want to mention, so she already mentioned it, but you know, the final part of our 4-part series will be this Thursday, where I will go over the nuances of what it means to do remote enrollment assistance using yourtexasbenefits.com. It's considerably more restrictive than because of HHSC policies, especially if you're part of the community partner program. So we'll be going over those nuances. It will be meant to sort of build on this webinar because, you know, I don't want to spend too much time going over some of the things that are similar in the programs around setup of your office, those sorts of things. It's more going to be focused on, okay, so what's different about doing Medicaid and CHIP enrollment, and what are some workarounds, because it's really hard. So I look forward to speaking with everyone on Thursday to round out our 4-part series. And then please, please, please consider joining Young Invincibles this Thursday, or both of us later this month for our State of Enrollment Conference. We're really excited to be able to do that virtually, and everything is free, so there's no registration fees. So, you know, feel free to come and join and learn with, you know, for part of the time, the whole time, whatever you have time in your schedule to do. I think the last thing I'll say, or already mentioned this, but do take a look in your inbox tomorrow. So there will be a quick email that I'm going to be able to send automatically. Zoom will send it to you, that will have links to today's recording and links to some of the things that we've already mentioned. So the final webinar, the YI Summit, and the State of Enrollment. But then later this week, when we have all the recordings in, I will send one email to anybody who attended this particular webinar series so that you have all the slides. I just don't have the ability to attach anything to the automated email. So but you will get all the slides and all the recordings, everything in one place hopefully at the end of this week, probably on Friday, once the final recording is up in the cloud and ready to be shared. And you can forward that to your staff so they have the complete package in one place. Looking forward to seeing everyone. We appreciate your time and attention this morning. It's hard to do something like this on a Monday morning, but we're so grateful that you joined us.
Yes, thank you all, and see you Thursday.
Bye, everyone.
All right, bye, Melissa. Bye, Stacey.
Bye.